everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of health IT interviews. And today we have a special guest from across the pond. His name is Jeff Haneen Jalil. He's CEO and founder at GPO Health. Welcome, Jeff.
Hey, John. Thank you very much for having me. Glad to be here.
Well, excited to hear your insights and perspectives. I think this is going to be a topic that a lot of people are dealing with today that I don't think before they probably weren't thinking about it as much. But before we dive into that, tell us a little bit about yourself and GPO Health.
Yeah, well, you might be able to hear from my twang. I'm actually from New Zealand, but I'm not quite across that pond. Actually,
that's a different pond.
It's a huge pond, John. Huge pond. But I've been in the UK for about 20 odd years, and I've been in the IT industry for a good 30. Of which close to 7 years, I used to be the head of procurement for electronic data systems and Unisys in the Asia Pacific region. And then worked for some of the big giants like Wipro and Cognizant, running a lot of their core businesses in healthcare. And, for my sins, I, have ran a lot of large technology shops, being in telecommunications, and also in, I would say, big data when it used to be big data and called new technology, mobility when it used to be, let's say, new technology back in the days. Mm-hmm. Been very fortunate to have established GPO Health probably in the last 15 odd months. And actually 2 days ago, 12 months incorporated in the US. So wow. Yeah, exciting times for me.
Yeah, definitely. So I think it's interesting. You guys work on some of these challenging procurement, supply chain problems in healthcare. But when I look at that, I think to myself, well, shouldn't the ERP be solving this problem that your company is working on? And how are you different, and why isn't the ERP solving the problems you're working on?
Yeah, well, a bit of background, right? GPO Health in itself, people say, well, what is it? Effectively, we are a market site for IT services. So think of us like compare.com or expedia.com for the insurance industry and the travel industry. We're trying to effectively lower the cost of IT services and IT costs so that we could place more money back into the hands of our clients to improve patient care. So you raise a very good question. Shouldn't ERP be solving a lot of these key problems? I would actually say that ERP is, let's say, somewhat the root of all problems, right? And why? Because in IT services, having delivered it and sold it, for a number of 20 odd years, we tried to make it as complex as possible for people to buy it. And people used to say, oh, you could never compare my solution or my technology with one other person's, right? But you used to think, well, actually, why did you used to hire all those big consultants that were out there to actually run a large procurement process? And what do they tell you at the end of it? They would come up and say to you, well, now that we've actually got apples with apples, we've gone from, let's say, 10 vendors down to 3, and we've down selected for 2 for you to choose. They both are exactly the same. And it took me, 3 months to get there, or 6 weeks to get there. So, I think ERP in itself, the way that you capture data is always unique. The way that you might enter it into your system might be unique. The way that you describe what you have purchased is actually unique. So what we use is artificial intelligence and machine learning to, let's say, remove a lot of that complexity and ensure that you can find some common ground to actually do that comparison real time, which I think, we've signed up a number of large sourcing companies, that are running, hundreds of millions of dollars in strategic sourcing and category management. And they look at our data and think, wow, we have never been able to get to that level of detail before. And, they themselves have got their own data science team, have got their own analytics team, and they look at what we can do with the data so that they can, let's say, do what they normally do, which is execute on great data that they might have manually, let's say, gathered.
or they might not, right? Because they don't have the time or energy or access to the data, right? I mean, I want to push back a little on your comment about they're all the same. I think that's interesting, right? I think that every IT vendor thinks they're a snowflake, but they're more similar than we appreciate. But if that's the case, then why do I need you, right? Like, so I mean, I think it's an interesting balance, right? Because if they're the same, then I can just, ask them and evaluate, right? But if, I mean, as you look across it, do you help to pull out some differentiating features, or is it just differentiated pricing, or how does your platform help them find some differentiation?
But I think, you mentioned it, right? Every IT service company thinks that they're a snowflake.
Yeah.
Right? Absolutely. My people are different. My solution is different. And so therefore my pricing is different. The way that I've actually written my scope and my set of services is very different. But I said, actually, they're fairly much the same, right? Mm-hmm. So what I'm actually trying to do is that complexity that people have, from a snowflake perspective, they're all falling from the snow, snow clouds, and they're all coming up and saying, hey, this is what I can actually deliver, right? And it's very different from everyone else. What we're trying to do is say, well, actually, you're not that different. Really, you're not that different.
So it's just illustrating they're similar.
Yeah, it's just illustrating because, think about it. John, I used to run P&Ls, worth hundreds of millions of dollars, if not billions of dollars. I used to actually have a bench, but the bench would be typically the same as any other IT services company. You could not afford to keep a big bench, right? Mm-hmm. So when, an award used to come, what did you used to do? Recycle the people that were inside your organization to deliver something that was new because it's net new business, right? Because you didn't carry a bench to actually cater just for that new piece of business. So the people are the same, right? And even if you had to hire externally, then what was going to actually make it unique? Is it your processes? Is it your methodologies? But as you know, when a person gets on the ground to deliver the services, is it actually the person on the ground that is the unique person in front of you? But how did you get there? How did you get to the pricing? How did you actually get to understand how many years of experience that person had? What engagements has he actually been doing before? And then how do I start to compare that? It's seen as, let's say, one of those big conundrums.
Yeah. Well, I mean, it seems like to me that what you're doing is almost providing visibility into the potential problems and costs that many people don't realize, whether it's because they've been with one vendor for a long time or whether, I mean, let's be honest, I think many people treat it as ignorance is bliss, right? Like that they've just done it and it's not be a problem. They don't think it's a problem. And is that fair that that's what you're doing, is providing visibility to help them understand that, hey, you may have done this for 5 years or you thought this way, but here's another way to look at it. Is that kind of how you approach it?
Well, John, either you've done your research really well or this is a leading question, but that's why we call our platform the Sourcing Data Transparency Platform. Because you're quite right. What we've found through, looking at, let's say, billions of lines of data is that you might actually have one client and he might have 3 vendors, but he might have one role, but 11 different rates. And he might be thinking, I'm doing a good job. And he is probably doing a very good job. But we're providing transparency that you're saying, hey, in your complex statements of works, in your invoice data and everything else, we can show anomalies with regards to where there is a difference in rates. Why should you be paying more with one particular role versus, let's say, another? Or even within a vendor, you might actually have, let's say, 4 variations of rates for the same role. Yeah. And then, there's so many use cases that have popped up, John, to reduce IT costs. It's not about benchmarking and is it the lowest benchmark, but if you're, for example, paying a lot of money for certain resources, but you've also got a support contract, if we show that for the last 3 years that your support costs are going up and your costs are increasing with resources that are coming onto the platform, I would have thought a mature technology over 3 years, your support cost should be going down, or your support cost should be included as part of your support contract.
Uh-huh.
But what our contract, what our platform can pull out is, hey, these sorts of resources associated with this technology has actually been utilized, and it's associated with your original support contract. Should you not look at that as an option? So many use cases that are out there that our technology can bring light to. It's pretty exciting, very exciting.
Yeah. So, I mean, I read on your website that you're using some AI and machine learning for this as well, which seems very in vogue. I think you can't be a company and not mention AI and machine learning on a health IT website these days. What's your approach, and how are how do you see kind of the use of this machine learning AI in your product?
Yeah, well, as my data scientists, tell me, Jeff, AI is all about teaching and learning, right? Machine learning is about the repetitiveness and then being able to really scale it at will. And so when we first started with this, our first AI was associated with word association. And as my, doc used to come up to me, data science, he'd come up to me and say, Jeff, we're at the infancy stage, from day one. He said, eventually we want it to get to kindergarten. And then from kindergarten, we want to then teach it to actually go to college. And then I want him to be a doctor like me who's got a PhD, right? And so the AIs that we're actually utilizing have grown rapidly. So we're about 50 AI that have actually been built and incorporated. We've taken some of the best AI that's out there from an open source perspective, and then we've built our own AI integration on top and our own AI. And then all the machine learning that actually goes with it. It's all dictated by what data sources that you're actually bringing into the AI so it can learn. So as my CTO and co-founder said, Jeff, for insights into IT services for healthcare, we are at the nirvana stage. Our AI understands everything associated with a platform, a technology, a skill, a resource. It would take a very complex statement of work, 100 pages, 200 pages, download it in and actually concisely condense it into a summary, and then be able to extract all the information so that it can be compared against an invoice, a purchase order, a change request. So very, very intelligent.
So what kind of data sources are you dealing with? Is it largely the ERP data, or is it just the procurement data, the supply? I mean, what data are you really, what data do you focus on?
We are so hungry for all sorts of data, John, that actually just makes us, really hungry to actually complete the picture. So we first started with very simple. We started with a lot of public information. For example, General Service Administration contracts that the government lists. There are thousands of contracts that are out there that, the big integrators and small integrators who are contracted to federal government to supply. That's all been downloaded. Wikipedia, KBpedia, information from, Glasshouse and all these other sources that are out there. We either purchase the data or, we scrape the data. And then, more importantly, we get all the data from our vendors and our customers. So our customers effectively download their statement of works, their invoices, the purchase orders, their change requests. Mm-hmm. We rip that into our AI, and then we fold that in with all our other external data sources so that we can make some sense out of it. Because as you can expect, going back to the original question around ERP data is somewhat, let's say, structured data, incomplete data, and not consistent data. Mm-hmm. So what we're trying to do is, with all our AI and ability to actually read everything, bring it to a point where it is common across any form of other statement of work that might have been generated. We create a digital fingerprint for the invoice, a digital fingerprint for the change request and invoice. And we're creating multiple digital fingerprints for statement of works. So all these, let's say, digital fingerprints are unique. And once it finds something quite similar, it tags it, understands it, and draws similarities to it and then categorizes it. So all these points of data we keep on bringing in from our sourcing partners, from our vendors, from our clients, external data sources. It's just forever consuming more and more data to actually get more intelligent.
Interesting. So what are some of the common problems or maybe even opportunities that you're finding as you bring in all this data and you evaluate it? What are those, is it just the efficiency of understanding it, or, what are the opportunities available to healthcare organizations once they work with GPO Health?
Clear cut, very simple. We look to actually save clients anywhere between 12 and 22% of their current IT services spend. And some people say, well, we've already diagnosed or let's say pulled apart our IT services spend down to the nth degree. We believe with our platform that we'll be able to provide an additional 12 to 22% saving. Now that saving can cut across benchmarking through efficiencies. We had one client that found out that close to over $1 million was paid out in excess of their statement of work, and questions were raised. View of various statement of works, purchase orders and invoices without statement of works associated with it. So depending on the size of the organization, it could be just a process issue, or it could be a compliance issue with regards to it. And I think one of the more interesting, use cases, that we've got is having access to, vendors who are on our platform, because we operate as a group purchasing organization, and, providing them with, healthy alternatives to their current supplier base. So, yeah, I think one quote that will go up onto our website very soon from the CIO from Community Health Options is that he had access to a procurement team that gave him the ability to, let's say, get to a solution quickly, but he still had control of the decision-making process. So, that's, quite a endorsement.
Yeah. Well, I mean, I think it's an interesting challenge. It's interesting how you applied it to IT. I've heard that in the revenue cycle side, something similar. In fact, you see whole businesses who say, hey, I can make your revenue cycle more efficient and just, I can reduce it by 10 to 15%. You're doing the same thing in IT procurement. So it's fascinating to see it applied that way.
Well, think about it as well, John. What are technology companies going out there and doing? They're saying, hey, I can make your business more efficient, but pay me $10 million to actually implement it. Yeah, absolutely. But who questions, besides the procurement process, whether or not they're doing an efficient job and whether or not they can actually be more efficient on a real-time basis? So the epiphany for me is, hey, if I could go out and buy, better travel services, better insurance, or, better revenue cycle management capability, then why can't I buy better and efficient, more IT services as well, right?
No,
and to be honest as well, we just started out with IT services, but we've just signed an agreement with one of the largest GPOs in the US, and we're providing some analysis on billions of dollars of spend. And we just said, let's just focus on some hardware. So we focused on just a simple thing, laptops. By virtue of doing nothing, even though that they got great contracts, we can actually save them another 20%. Not because we can actually get the cheapest price, but because some of those vendors that are, let's say, supplying, some of these laptops, they don't always give you the lowest price that across the same hospital system. So already, we can demonstrate significant savings across laptops, computers, peripheral equipment amongst your existing spend. Because who looks at thousands of invoices? Yeah. Right?
There's so much inefficiency.
Is that model number the same as that model number? Is that price the same as that price? No one does that. Right?
Of course not.
No. So to your point, yeah, why not? Go figure, right? If you can make money out of a business, out of revenue cycle management, then surely, efficiencies that can actually be gained out of reducing IT services costs, every dollar that we, allow or give back to the CIO or the head of procurement or the CFO inside a hospital is another dollar, going towards patient care. So yeah, it's super important for me because, right at the beginning, you asked me, a little bit about myself. I lost my brother to cancer. And, it hurt me a lot. And I'm just thinking to myself, why can't I, do something a little bit more and give something back? I'm at the stage of my career that, I'm lucky I can do that. And at the same time, really add value to a client's business.
Yeah. Well, with that note, I'll avoid my cynical about how they'll use the money, but that's a different discussion for another day. But no, you're right. I mean, the more efficient we can make healthcare, the better, they can provide care to patients. That's great.
Yeah.
We haven't mentioned COVID, so I don't think any interview can go without COVID for now. But how is procurement and this IT procurement really been impacted by COVID? What have you seen, and what's changed, and maybe what hasn't changed? I think it's interesting you go to the hardware side. I know so many people who, they brought in 2,000 laptops. Now they're figuring out what to do with them. But I'd love to hear what you thought, as far as what impact it's had on the procurement.
It's funny you say that because, we were doing the analysis of hospital system spend, and that spike in March of the number of laptops that came in, and then the follow through of accessories that came past that was huge. Yeah. But, let's be really plain and simple. A lot of organizations are trying to button down the hatch and look for cost saving initiatives, right? And COVID's really, what I've seen is saying, hey, we need to look at our cost base more efficiently, as they have always done. But I think more emphasis on what are they spending their money on and what can they stop spending on, getting ready perhaps for the onslaught post-COVID, right? Where more elective surgery is going to be opening up, and let's say the systems and the plans, going into full gear to actually support, let's say, all that pent-up demand. But, I think the problem with my business with that, it's a chicken and egg sort of situation. I don't have the resources to, get the data. So, what do I do? But I still actually have to save money. So I go back to the old, saying, right? What you can't see, you can't manage. Mm-hmm. And so if you continue not to gain a constant insight into your spend data against what you're projected to save, what was the use of the first initiative? So you might say on paper that you said you're going to save 10% or 20%, but when are you going to realize that? Once you do another procurement life cycle and spend another 3 months going through the invoice data, or 6 months to actually say, were those savings that I actually thought I was going to achieve, have I realized it, or has time passed on, right? So I think for procurement managers, it's a real big push. They personally goal to reduce cost. So I think the personal aspect of, how do you affect a head of procurement or a head of finance in a health system, how we can actually help them achieve their goals so that they can, let's say, tick off their box and make sure that they've achieved their goals and that they meet their personal objectives. But then you've got the CIO who might also be in that shoe, but also he might be thinking, I don't want to actually reduce my spend. I want to increase my spend. So I don't want that visibility. Mm-hmm. So you still actually have a few positions out there that, we've still trying to convince people that it is obviously a good transparency tool for them to have.
Yeah, it's interesting how how some people react differently to that discussion, right?
Human nature, right? Human nature.
For sure.
What's in it for me, to a degree?
Yeah, absolutely. So what, as we kind of wrap up, what's one thing that, or maybe even a couple things, if that a health IT leader should know about supply chain and procurement, I look at it and I say, if I'm a CIO, I'm distracted by staffing issues. I'm distracted by EHR implementation, by doctors who hate my EHR implementation. I'm distracted by regulatory burden. And so maybe I haven't focused on the IT procurement side as much as I should have. What are some things they should know? I mean, I think you shared one, which is there's probably cost savings there that you don't have the time to dig into and find. That seems like an interesting message, but anything else you'd add as far as what should they know about it?
Yeah, because I think, as we've progressed, data is king, right? The more data you have to actually understand your business, then the better you're going to be moving forward. The insights that we're getting from our data and how the use cases are progressing, going tenfold. First it started off with, oh, you're just doing benchmarking, not interested. Oh, you're doing spend compliance. Okay, yeah, I'm relatively interested. Oh, but now you're starting to think from a quality perspective, how well am I operating? And, we operate as a GPO, no matter what plan or a hospital system, no matter what size, the rates that are actually on the plan is driving towards a more efficient market space, right? It's all about supply and demand. From that, we appreciate that. And especially today, there's probably more demand than supply in some instances. But where are you going to get that supply from? So the more insights that you've got to your data, the more understanding of how you're managing your business, I think we can provide more insight. So we complement a vendor management system, a contract management system, an ERP. We're that deep data analytics that can actually help businesses move forward in a different direction.
Well, I think what's interesting is you say you want as much data as possible. Yeah. But the CIO is not going to do what you do, right? They don't have access to the data that you have, right? So I don't know. It just seems unfair, because if I'm a CIO looking at this, I'm like, okay, that's fair. I want as much data as possible. In fact, I heard a former executive at Dell say that, right? You want as much data as possible, and then you take that data, and sometimes you have to make a gut decision based on as much data and then also your understanding of the market. But they're not going to have all that data. I think that's, it feels like that's the differentiator for you. Is that fair, that you have more data than they could ever get access to, especially across the industry? Because maybe the largest health systems would have time to go do it, but probably not even then.
You're exactly right. And, John, if I've got a spare job coming on and you want to try and promote my business,
you need to hire me.
Yeah. We've got, we can provide access to, data and insights that most organizations just have no line of sight to, right? And I don't want to be big about this, but I look at the insights that we provide. Some of them are quite scary. And I think people have got to embrace it because, in today's world, if you don't know your business and you don't know your data that's actually wrapped behind it, then where are you at? I'll give you a classic case, right? Everyone talks about GL coding. Well, your GL coding is as good as what you coded it, right? So you say, oh, well, my GL coding tells me I've got $10 million in IT services spend. I can tell you at the moment, we're doing that analysis for an organization that actually the IT spend is about 3 or 4 times more than that. Because guess what? I'm a cost center manager. All my IT budgets run out. Oh, I'll put it under general administration expenses, right? So, and we've got numerous examples, where that's actually happened. Well, that could be a legitimate way to actually reposition the spend, but you might have lost some of your negotiation power by dispersing some of that spend, into common G&A. I'm telling you, AI is a wonderful thing, but a dangerous thing if you want to get insight into your data, because all of a sudden, any word that's associated with your technology, regardless of how you've actually coded it in your GL, we'll find it, right?
Interesting.
And so those insights are fascinating. So
definitely.
Yeah.
Well, I like to say we talk about this on the security side of things a lot, but ignorance is bliss until it's not. Yeah, on cybersecurity, that's when a hack happens, right? In this, it's once the CFO digs in and says, "Wait a minute, this doesn't add up," right? So this is great, Jeff. This is really interesting insights and perspectives. I appreciate you taking the time to share, and thanks everyone for watching. We'll have you back again. We'll talk more, but if you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com. Thanks, Jeff.
Thank you very much, John. Pleasure to be here.